Good evening, my name is Friendella Pierre Brown, and this blog is for Module 15 in my professional nursing and leadership class. Basically, what I'm going to be discussing this evening is advantages and disadvantages of team nursing. Now, usually with team nursing, what happens is there's a team of nurses that are assigned to a specific group of patients. Usually it's based on maybe the acuity level or the patient care needs. Not just nurses, you may have a group of nurses that take care of those patients regularly. You have your UAPs, your LPNs, and those specific people that are assigned to that group of patients. Now, there are some advantages and disadvantages of those, of having team nursing practices. Some advantages are that the patient feels more at ease, that they see the same people constantly throughout their course of stay in their acute care setting. There's always, you know who the team is. Those team members that are assigned to those patients know the patients, know their problems, their diagnoses, and can easily spot if there's any change in the patient's condition, level of consciousness, and are able to intervene or act upon accordingly. I work in a hospital. I used to work in a hospital where we practiced team nursing. There were several flaws with it. There were some advantages, like I said, and there were some disadvantages. There were a lot of the times, if you were in an area where let's say the patient acuity level was really, really high and you were assigned those patients, that means that every time that you came in, it really wasn't a spread of nursing, of care for the patient. So you and your team were constantly running every time you were in. So there was no balance as far as workload. What I didn't really care for was that the team leader, everything had to go through the team leader. So if you spotted a change of level of consciousness or a change in your patient, you ran it through the team leader, and he or she decided what the next course of action would be it page the doctor, order labs. And I think that took away from the actual nursing care, took away from the nurses being able to be proactive and actually be nurses and think outside of the box and troubleshoot and contemplate and say, okay, this is going on with my patient, what do I need to do next? And then if you got stuck, of course, go to somebody else. I always go to my senior nurses on the floor, or somebody, hey, this is going on, what do you think about that? But I think team nursing took that aspect away, because if you saw that the patient's lab was abnormal, you had to go to that team leader. She's the one that, called the doctor or reviewed the labs, called the doctor and decided what have you. Well, I mean, as a nurse, that's part of your job, and I think that's the part that I really enjoy most, where I can go in and I can troubleshoot and I can interact with my physicians and my ARNPs and my PAs and say, hey, listen, this is going on. What do you think about this? Let's do this. And because it taught me a lot, because then that way, if I came to the doctor with what I thought was a solution and he said, no, Fran, maybe we can do it this way because in my experience this and that happened, I learned from that, as opposed to having somebody else have that discussion for me. I think it is important as nurses to be able to speak up and to speak to their, attending physicians and to get comfortable with that, because you're going to have to do it. So I think having that team nursing took that aspect away from it. Again, like I said, there were huge advantages, because when I came in, I knew I was assigned to this end of the hall and these patients, and this is basically what their acuity level was. So this is what I did. But again, team nursing is just one advantage or one area of nursing. There are many other aspects of nursing that delivering nursing care, that they are being implemented throughout the hospital settings and throughout clinical settings. Usually you just find the one that works for the area that you're in and you stick with it. So I hope that this blog helps clear up any misconceptions about team nursing, and have a good evening.